Well, heart disease is the leading cause of death for women in the U.S., killing more women than all forms of cancer combined. Today, women are going red to raise awareness and hopefully save some lives in the process. Dr. Nidhi Kumar is on call to tell us more. Doc, good morning. Good to see you this morning. Nice job with the red here this morning. We can hopefully get everybody out there wearing the red. So what are the risk factors that every woman really needs to look out for?
Yep. High blood pressure, diabetes, obesity, high cholesterol, kidney disease. You know, we don't talk about that as much. You know, there are unique events in women's lives that put them at increased risk, like pregnancy is a major stressor on the heart, so it's so important to get those risk factors in check. And menopause, as women's estrogen level goes down, their cardiovascular risk goes up.
Diabetes and obesity, obviously a big issue in this country.
Huge.
And now with, I guess, a real concerted effort towards some of these GLPs and whatnot, bringing weight down, bringing obesity down. I guess it's a move in the right direction.
It absolutely is, and that's why you see with those types of drugs, you see they really are driving down cardiovascular risk.
Yeah, so let's talk about stroke, because I know that's obviously a big issue as well. What are the warning signs, and how do strokes look different in women compared to men?
Okay, well, the acronym to remember is FAST, facial drooping, arm weakness, slurred speech, time is the essence. If you see any of those signs, you want to call 911, but women can present differently. Nausea, vomiting, loss of consciousness, confusion. So it's something you always need to keep in the back of your mind. If a family member or if a friend is just not feeling right or acting right, err on the side of caution, seek medical help.
The American Heart Association recently came out with a study showing that black women with high blood pressure had greater risks of stroke. I guess would it be even more essential for African American women to make sure that they're tested and they're checked and their heart health is obviously top of mind?
Absolutely, and I'm so glad you brought this up. And for any black women that are watching right now, it's really important to take your blood pressure numbers very seriously. Black women who develop high blood pressure before the age of 45 have a 2 times increased risk of stroke. Before the age of 35, if they develop high blood pressure, 3 times the increase of stroke. So what's going on with this patient population? There's more comorbid conditions like diabetes and obesity. There is this lack of awareness, not just amongst the patients, but healthcare providers. So we need to do a better job as healthcare providers to take care of this population of patients.
When we talk about patients going to see their doctors and knowing their numbers, whether it's cholesterol or whatever, for those out there that are like, well, what are you talking about when you say check my numbers? What's the best explanation for them? Okay,
so it really comes down to knowing what your risk factors are and trying to hit those number goals. So blood pressure, less than 120/80, blood glucose less than 100, LDL cholesterol, that's your bad cholesterol, you want that less than 100, BMI less than 25, and waist circumference less than 35.
Yeah, visceral fat, that's a big issue with people, right?
Big issue.
All right, Doc, thank you very much. Great to see you as always. And you can catch Dr. Kumar's health reports every Monday, 7:15 a.m. right here on CBS News New York. And on special days like today, we have her in on a Friday.